Naam, asanteni kabisa. Na kabla tuendelee, tungependa tuweze kuomba. Tufunge macho na tuweze kumshukuru Mwenyezi Mungu. Na Mungu Baba, Mungu ishie, Mungu wa milele, tazama tunakuja mbele zako siku ya leo. Tunaweka wananchi wote wa Nairobi mikononi mwako. Tunaweka wafanyakazi wote wa kaunti ya Nairobi pia mikononi mwako. Tunamweka gavana wa jimbo la Nairobi mikononi mwako. Tunaweka wafanyakazi wote ambao wako katika kitengo cha afya mikononi mwako. Tazama Mungu Baba, tunakuja mbele zako hivi sasa kuweza kuzindua vifaa vya matibabu ambavyo vitaweza kutumika kuwaponya na kuwahudumia wagonjwa wote ambao wako chini ya kaunti hii ya Nairobi na wengine kutoka sehemu zingine mbalimbali. Mungu Baba, anapofanya hivyo gavana wa gatuzi la Nairobi, tunaomba umjaze hekima, umjaze nguvu na umjaze weledi wa kufanya kazi yake ipasavyo. Mungu Baba, tunaomba haya machache kwa jina la mwanao Yesu Kristo tukiamini. Amina.
Yes. Your Excellency, the Governor of Nairobi City County, His Excellency Governor Sakaja Arthur Johnson, our Deputy Governor, His Excellency Njoroge Mshiri, all protocols observed. Good afternoon. Yeah. We are gathered here today, Your Excellency, to request you to flag for us these medical equipments which were procured for all our county health facilities. Your Excellency, when you came into office, most of the facilities that were constructed by NMS were never equipped. You directed that we procure all their medical equipments, which Your Excellency we have done as you directed. And here today, we have 2 trolleys full of those equipments. And here are some of the equipments, Your Excellency. So today we are here and we are requesting Your Excellency that we want to assure you that these equipments, Your Excellency, will be put into good use to all those facilities. And we assure you that we have a team of our biomedical engineers who will ensure that they are installed in all those facilities that will be receiving these equipments. Your Excellency, allow me call upon my team, which are supported to make this a success. Our directors, our county biomedical engineer, kindly move forward so that Your Excellency can see you. Your Excellency, this is the team that has made this a success. She's okay, yeah. Your Excellency, allow me invite the CC to give her remarks, then she'll continue the program.
All right, thank you everybody. Your Excellency, the Governor, the Deputy Governor, all CCs present and all protocols observed. Members of the media, good afternoon. Today we're gathered here to celebrate yet another milestone for our health sector. As part of the first consignment of equipping our facilities and making sure that they are fully equipped. A facility is not just the structure, it is the equipment, it is the people, and this is towards the steps to making sure that we provide that sufficiently. I won't take too much of your time. I would like to invite the Deputy Governor of Nairobi to give his remarks and thereafter invite the Governor.
Your Excellency, the Governor of Nairobi City County, Governor Sakaja, the County Executive Committee members here present, the directors present, the chief officers present, invited guests. This afternoon, we're here again to commemorate yet another milestone in our health service delivery journey of ensuring that the hospitals and the health centers and the clinics that we've set up in the county have the right equipment, have what it takes to to be able to deliver services to the people of Nairobi. Yesterday, we were out in Mama Lucy, as you saw, where we were opening an ultra-modern eye clinic that is going to, or eye hospital, sorry, that is going to help our people in being able to regain their sight or improve their sight. And today, we are continuing on that journey to ensure that our hospitals are well equipped, our hospitals have the right equipment, and our hospitals are able to serve the people of Nairobi, and as we saw yesterday, even beyond to the other counties, as we improve on the livelihoods and the quality of lives of the people of this county and this country. So it's very, very important for us that we continue on this journey, because it's a journey of ensuring that we keep our promises to the people of Nairobi, to the people of this country, that we said we will serve and will help create a city of order and dignity, hope and opportunities for all. When you have this kind of equipment, it creates employment, it creates opportunities for people to work, and most importantly, it improves the health of people who are then able to go and do get involved in gainful employment wherever they work across the county and country. So with those few remarks, I'd like to now ask all of you to join me in welcoming His Excellency, the Governor of Nairobi City County, Governor Sakaja, to come and speak to us. Your Excellency.
Asante sana, Deputy Governor, mawaziri, chief officers, directors wa health na wote ambao wako hapa, wananchi wa Nairobi, pamoja na watalii wale wako huko kwa hiyo kona, wanaonyeshwa ile kitu tunafanya. Nairobi was voted the best city in the world. Hamjambo. Hamjambo. Bungu hujambo. Mko bie. Mko salama. Haya, asante. Wacha nisome hii kizungu kwanza alafu tuongee. Sawa. Petit, hujambo. Kiprugut. Jamal. Haya basi, nyu wote. Being here today affirms our commitment to provide top-notch healthcare to the people of Nairobi. Our administration has continued to ensure that our hospitals have medicines and medical equipment. We have reinforced that commitment. On Valentine's Day this year, I remember we flagged off supplies worth 244 million shillings that the county had not received since 2020. Today, the equipment that we are flagging off will be distributed to various levels of our facilities. It's not just a collection of machines and other medical supplies, but truly it represents the promise that we made to deliver the best possible care to our community. This equipment that is here and in the trucks behind us is valued at 58 million shillings. It consists of delivery beds, digital portable X-ray machines, ECG machines, patient monitors, dialysis machines, vaccine refrigerators, nebulizers, and other key equipment that will improve diagnosis and treatment of diseases in our hospitals. This will reduce the burden on our healthcare professionals in diagnosis and make their tasks more efficient and less physically taxing. We're in the process of upgrading our level 4 hospitals by better equipping them. As part of what is delivered today is we have water purifiers that will be installed in 7 of our level 4 facilities to ensure safe water in these facilities. A new theater is going to be delivered in Kianda 42. It is being completed, so the equipment is here. That is in Kibra, Kianda 42. In Mutuini, we'll also operationalize for the first time the theater by the end of this year.
25th August 2022 marked the inauguration of a new chapter for Nairobi City County. A year ago, Governor Sakaja Arthur Johnson and Deputy Governor Njoroge Muchiri took the leadership driven by a vision to transform Nairobi into
Officer Musiria, Chief Officer Irene, and Chief Officer Tom, and your directors. After yesterday, the news, I got some phone calls. People didn't believe what we did. Wanauliza, umefungua eye clinic ama department. I told them we've opened an eye hospital, the first public eye hospital in Kenya. Zingine huwa ni ya makanisa kama Kikuyu ama Lions, ni private. Watu wa Nairobi huenda mbali, wakienda huko wanaulizwa pesa nyingi sana, 70,000, 80,000. Sasa hizi kama unajua mtu yote ana shida ya macho, kama wale hawaoni maendeleo yetu, hao pia tunawaambia waende Umoja True, Mama Lucy Eye Hospital, to restore their sight, because everything is plain for everyone to see that it is working. Umoja True Annex is one of projects that stalled. We have given clear instructions that all of them must be completed, kwa sababu ni hela ya watu wa Nairobi. Project ikianza ikose kukamilishwa ni hela zimepotea. So tumesema kabla ya kufanya zingine mpya tumalize zile zote zilianzwa kutoka wakati wa Governor Kidero, zote ambazo zimekwama kule Mathare, kule Kibra, kule Roysambu, kule Njiru ambapo nilikuwa juzi na MCA wa hapo. Hizo zote lazima tuzimalize so that we can be prudent stewards of the resources of the people of Nairobi. So mambo ni mengi ambayo tumefanya, tunazidi kuendelea katika pande ya afya. ICU ya Mama Lucy inaendelea tangu ifunguliwe. Kuna watu wengi wameweza kupata huduma hapo na tumeokoa maisha yao. Tunaweka pia CT scan mpya Pumwani, tumeweka ile lift mpya, najua inafanya kazi. Mara ya mwisho ifanye kazi ilikuwa 1985 na sasa inafanya kazi. Akina mama hawatembei kwenda mpaka theater ama kurudi chini, wanapelekwa vizuri sana. Distribution of drugs is also ongoing, and we want to continue putting people on notice, those who had been used to taking drugs from our facilities and selling them in private facilities next to our hospitals. We will not allow that to continue. I think as we conclude, I must mention that we've seen a lot of challenges with people simply following the law and abiding by what the law provides. I want to stress that we will not allow for impunity in Nairobi. We can't allow for impunity. If you allow for impunity for a small benefit, wale wanaumia ni watu wa Nairobi na wanaumia zaidi. Leo nimekuwa na situation kule Westlands, Jendo Madhenge, muona imekuwa flooded, na ni kwa sababu kuna mtu anajenga nyumba na tulimwambia hapo April kwa sababu wameziba njia ya maji. Tuliwaambia warekebishe. Ile approval ilipatianwa, ilikuwa na njia ya maji kupita kuenda hadi the main drain, na wakakataa. I have issued instructions that developer and architects and that team be arrested immediately. That construction has been stopped until they comply with the law, because wanaribia watu wengi sana magari, wanaharibu barabara yetu just because of one person having impunity. I've also asked the county secretary to give me a report before end of day on the officers in the county who, despite knowing that should have stopped, let it go on, because we can't allow that impunity from in here, beginning from in here. How ma developers wanafanya makosa hawezi kufanya kama nyinyi mngefanya kazi yenu. They will not be able to do that if we are abiding by the rules within here. So we need to know who needs to respond to that. Na tumewaomba msamaha, engineers wetu wanafanya kazi kuhakikisha hiyo maji itembee, lakini nimefurahi sio maeneo mengi ambayo wamepata hayo madhara. Ingawaje kumenyesha sana, many places are flowing because of the work the Green Nairobi are doing. Mahali kumekuwa na shida, miti imeanguka kule Buruburu, tumetoa asubuhi, pale Karen kumekuwa na shida kidogo, and we're continuing to do it. But I will continue to appeal to the people of Nairobi. Let us stop illegal dumping. Let us stop illegal dumping on our drainages, because that is what is clogging the place up, and that is what is, giving us, undue tasks, that we should focus the energy of our young people in other activities. I want to also announce that the process of completion of the recruitment of the 2,500 and the additional 1,000 is ongoing. So wale vijana ambao hawakupata wanaweza kuwa kuna nafasi wakati huu. Wale ambao tunajua walikuwa karibu kuwa shortlisting tunamaliza. Wiki hii tunamaliza shortlisting ya madaktari na wale nurses wengi ambao wamekuwa wanatuhudumia wakiwa NMS na pia constables, ili wote warudi kazi, wafanyie watu wa Nairobi kazi vile inahitajika. So asanteni sana, tuendelee kujivunia kuwa watu wa Nairobi, wakaaji wa Nairobi, mji ambao utakuwa mji wa mpangilio, hadhi, matumaini na nafasi. Si ndio? Yes, yes. Order, dignity, hope and opportunity. Asanteni sana, Mungu awabariki. Sijui kama mna maswali wa ndugu zetu wa. Yes, introduce yourself and tell us a question. Sorry? Njeri? Royal Media. Radio Biblia. Waumini, it's the same thing, Biblia pia. Yeah. Yes, we'll ask the health team to give a list of the facilities. They will share that with the media. They're going to facilities from level 2 up until I think level 4. Yeah. Level 4 facilities. So watawapatia hiyo orodha ili pia mfuatilie mwakishe zimeenda. And what I like that Mosiria does and his team, wakipeleka madawa ama equipment wanaenda na MCA wa hapo, ili MCA pia aone ya kwamba hii equipment imefika ili tuchunge hiyo equipment. So that is part of accountability that we need. Yes. 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 Yes, thank you very much. Of course, that is a very important question. The rainfall, as it continues to increase, we'll have public sensitization. We have been doing it at the sub-counties, together with our sub-county admins and ward admins. But we shall also publish in the papers and on your news channels for people to know areas where we may need people to move. The emergency number, if you see any incident that you want to report, 1508 is a toll-free number that you're to call. 1508 to call us. Our disaster teams are on 24/7 response. If a tree falls, if there's any, anything that needs our response and attendance, we will attend to you. So we shall be sensitizing. Many people, you remember early in the year, we lost some children in Waruku when there was flooding. We're happy that we've not lost anyone in Nairobi, and we will not lose anyone. We will make sure that we keep our people safe. We're also giving humanitarian support in terms of food, blankets, and for those who've had to be moved. Yeah. I'll take one more if there is. Yes, Ndugu.
Thank you very much. My name is Mike.
Yes. Okay.
And we are very much grateful. Just recently we received that our contract has been renewed.
Yes. Yeah. Oh no. Pole. Are you still working? You're working, but you didn't get your letter. Give me the list. I will renew myself. Asante. Asante. So these are 18, 23. We value your services. You people do a lot. In fact, in addition to renewing, we want to see how to absorb, Of course, that relates to our costs and our budgets because there were 143, isn't it? 143 in total. So all of the 143 need to get back to work. Mko kazi saizi tunaposema. So Susan, make sure they're back. And Charles, make sure they're paid. From July. Wewe ungekosa from July, will you not be looking like that? You'd not be smiling. Thank you for your resilience and sorry about that. I think there must have been an oversight. So nyi mrudi job. Sawa. Asante. Nani mwingine ana mambo? Yes. 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 Yeah. Karibu. Thank you very much, Gatete. I had mentioned a bit, but let me just repeat. Number one, we're very happy and grateful that the work of the Green Army has borne fruit. We don't have the level of flooding that we normally have. And in fact, the areas where we are seeing issues, for instance, Jendo Madenge, is because of impunity. There is a developer who had been told to mitigate part of his plans in April. I was personally there with my team. He has blocked the waterway that leads to the drainage that goes all the way to Peponi Road. And he was not able to do it. He continued building despite a stop instruction. We have, our teams have been there this morning. We're implementing what needs to be implemented to lead the drainage to the tunnel and to where it's supposed to be. But we've ordered the arrest of that developer for going against the regulations. And I've spoken to the regional commander, Mr. Bungei. He is effecting that. In Kasarani, we also had an issue where our flashing unit now is, the Green Army was there yesterday. They have not been able to unclog it because of the flashing unit. The flashing unit is dealing with that. Many areas where you're used to very high levels of flooding, water is flowing. It's flowing well. We shall send the statistics of the areas where we've done this mitigation. In the informal settlements, as you've mentioned, where there's a lot of flooding now inside people's houses and inside settlements. Many of them were giving humanitarian support, food support, and helping them drain. But in the public spaces, on our roads and public utilities, I think we've seen a marked improvement. And I must congratulate Ibrahim. Where is Ibrahim? Ibrahim and the team. There's a multi-agency team led by Bram Simiu, who's in charge of disaster management, that has really done a great job. So please make sure you issue a statement, including that which will inform Nairobians of further action that they may need to take, but no need for panic. In case of any issue, 1508 is the number, toll free for you to call. In case you need an ambulance, in case you need, for instance, this morning our fire team was, sowing trees that have fallen, blocking roads. Mumias Road is one of the roads in Buruburu, where by 6 a.m. the teams were there and they were able to open up that side of the city. We also had the same incident in Karen, where our teams which are led by the sub-county administrators are actually being able to offer that mitigation. So tunaendelea mzuri na tutazidi, watu wasiwe na wasiwasi. Na hatujahitaji hizo boats tumeona hakuna haja. Tulisema hizo hatununui. Asanteni sana. Wacha tuzindue hizi ili tuendelee na kazi. Where are we flagging off? Thank you.
August 2022 marked the inauguration of a new chapter for Nairobi City County. A year ago, Governor Sakaja
Excuse me, sir. Excuse me, sir. Natuonyesha.
Oh, hii ni diagnostic kit, eh?
Okay.
Ya iko na what you call an otoscope with a magnifying glass. Iko na pia speculum. Pia iko na ophthalmoscope. Unasikia hiyo? Alafu kuna nasal speculum. Kuna bent arm illuminator na laryngeal mirrors. Hii laryngeal mirrors ya kuangalia throat. Na tongue depressor holder. Then there's a spare halogen lamp. So that's just part of what we have here.
I see the box. The box.
Something, huh?
25th August 20.
Kulia. Mwenye chumba. Wewe una ya watu baro.
25th August 2022 marked the inauguration of a new chapter for Nairobi City County. A year ago, Governor Sakaja Arthur Johnson and Deputy Governor Njoroge Muchiri took the leadership driven by a vision to transform Nairobi into a city of order,
Pato.
Gavanare!